So when I walked into this patient's room and he said this to me, I froze right there on the spot because it was true. So, hi there. If you're new to my channel, I'm Dr. Andrea O'Connor. Thanks for being here. And if you like this kind of content, hit the like button. And hey, you're welcome to subscribe. It's free. Would love to have you here where we talk about interesting things and kind of like to talk about the supernatural and the paranormal. Yeah, it's true. So, and if you don't know me, I work full-time in healthcare and I've talked about it on a previous video. You can go ahead and check that out. So, I am going to tell you the story that froze me to the spot I was standing in. But I actually looked up and I was like, is there anything like kind of exactly like my experience that I'm going to go into? And this was the closest thing I could find. And so this was a true story. I've got to tell you this first just to give you some context. So we've got in 1984, this woman had a brain tumor and she was telling her doctors, her family, her friends, she's like, I'm hearing a voice. Now, completely normal background, a normal, everyday, just regular person, right? She had no history of psychic phenomenon, powers. She wasn't a psychic. She wasn't doing readings. She wasn't dabbling in the occult, nothing like that. But she said she began hearing a voice in her head starting in 1984. She was insisting that she had a brain tumor and she could even specify the location in her head of where this tumor was. And mind you, she had no other symptoms yet because usually when someone has a brain tumor, we'll start seeing or we'll have patients come to us and say they're having headaches, blurry vision. You might even see the alignment of their eyes starts to go off. They might be complaining of nausea, ringing in the ear, but usually it's like unrelenting headache. But she had none of these things. She had none of these, no other symptoms. But this voice in her head, this persistent voice, prompted her, get this, to seek medical care, to seek some medical tests. Like, you need to find out what's going on. Okay. Now, it's not like, when you're witnessing something weird and something in your mind says, you got to get out of here. But it's not really a voice. It's really, what is it, your intuition or your inner voice? So, but this was different. She was saying this was a brand new voice in her head. So she did go to the doctor, and guess what? Doctors confirmed that she did indeed have a brain tumor. And not only that, but the tumor was exactly where the patient had described. So this is a real case. It is on the internet. This is just, one of those examples of like, okay, when someone's very ill or near death, can they all of a sudden have more intuition? I've said it on a prior video that one of the, because there's like signs and symptoms, I'll call them the vital signs of death, if you will. I'm sure other people have called it that too, where, you'll see changes in breathing pattern. People will see loved ones coming in the room that have passed away before. They'll actually have more of a sense of peace and calmness. And again, I don't know why that like button comes up. I don't know what that's about. So maybe there's someone in here that agrees with me. But so, there's certain signs, and I worked in hospice for 10 years. We kind of know when someone's close to death, and again, their hunger changes. They're not drinking or eating anymore anyway. But the thing that I noticed, and a lot of you that worked in hospice noticed this too, some of your patients start to become aware of things that they weren't aware of before. And I've always said, I think one of the veils drop, right? Because they're getting ready to go on to the other side. And so, when I was in hospice and this happened to me, that I'll tell you, and I was seeing experience after experience, and then it just really just kind of was like, what is going on here? I've always believed there's another side. I always believed in a higher power, all one consciousness of God. So here's what happened. So I'm working, I did a lot. I've done home health and hospice, and this was years ago. So I can't remember exactly what facility, but was going into one of the facilities to see one of my patients, and I had my scrubs on. And most of us like to wear loose, comfortable scrubs. This is important to the story. So I'm wearing my loose, comfortable scrubs, nothing revealing. And, I'm not sharing anything going on with my life because it's all about the patient. So, and I had seen this patient before, I think a couple times. So I walk in the room. Again, I cannot remember the patient's name. I won't say it anyway, but I was like, hi, how are you doing today? Is your pain controlled? Is there anything I can get you? Let's do an assessment, all that. And before we can even proceed, he says, you're pregnant, aren't you? And not only that, I know you're going to have a baby and it's going to be a boy. And I kid you not, I froze. And I've seen so much in my life that it takes a lot to get me to freeze now. Because, if you're in healthcare, you see a lot. But I froze. And I'm just standing there because the wild thing was completely true, by the way, because I was pregnant at the time. You couldn't tell because I was really early on in the pregnancy. You could not tell. I was in the first trimester, which means you're in the first 3 months of pregnancy. You couldn't see based on the scrubs I was wearing. There is no way. Plus, in the beginning of the pregnancy, how do you know that I'm just not fat? Right? Maybe I gained 10 pounds or something. But you literally could not tell. So I'm just frozen. And the interesting thing, and I was thinking it through this morning as I was remembering the story, that not only was he completely right, I've never, a lot of women will say, oh, you're pregnant, aren't you? Because I'm telling you what, women sometimes have an intuition, and I don't know what's going on, but a lot of times, I guess it wouldn't shock me as much if a woman came to me and said, oh, you're pregnant, aren't you? Especially if they've had kids. Something about women, we kind of sort of recognize the signs, and I don't know. Maybe I'm wrong, but for a man, an elderly man to say, oh, you're pregnant, you're going to have a baby, and it's going to be a boy. I'm sorry. That was completely true. And I happen to know it was true because I had an ultrasound. Usually you have to wait so long for that ultrasound to know the sex of the baby, right? So the gender of the baby. And he was right because I knew it was going to be a boy. I knew it was a boy. The ultrasound said it was going to be a boy. And this man knew that I was going to have a baby and it was a boy. That just froze me. But I was thinking about that story, and I feel like that's another one of those examples of where that veil can just drop. In hospice, when patients are getting ready to go to the other side, I've seen it time and time again. They're, I don't know, what's the word, gifted or given the right to just have more insight than the rest of us. So, what is that? What is that? I'm still trying to figure it out. I am still trying to figure out why that goes on. And that's why I like to share my stories, because a lot of you will comment on your page too, what you've witnessed in hospice healthcare or just among your family members. I just think it's fascinating, but it froze me in my tracks. I kind of giggled to myself. And then I told him, well, yeah, actually, you're right. That is what's going to happen. And he wasn't like, see, I told you, or I'm a psychic. No, none of that. He was just like, yeah, okay, well, you're going to have a great life. Okay, let's go on with it. Did the assessment, did the visit as normal after that. But I never forgot that story. And I think of it now, and I still think it's amazing. So I'd love to know what you think about that. Thanks for being here on this channel, and I will see you on the next one.